So now that you know a little bit more about the name behind KALON WEST and what it means, which if you were not there for the prior video, KALON is a noun that refers to beauty that is more than skin deep. And in other contexts, it actually translates as to health that is more than skin deep, which is what we're all about here at KALON WEST as functional medicine, integrative medicine, regenerative practitioners. We are about root cause problems being solved or helped. We are not about masking symptoms and just kind of putting a band-aid on things haphazardly. So KALON WEST, what do we do and what do we offer to the Joe Blow, kind of walking off the street? Not that you're Joe Blow. I mean, you're definitely more than that in our eyes. But what we do is a few things. So first and foremost, our bread and butter, what we are most trained in and really love to preach and practice is hormone therapy, bioidentical hormone therapy to be specific, which if you're not familiar with the difference between the two, we will educate you on that, believe me. But bioidentical hormone therapy using compounded products from local pharmacies like SAFA or NextGen, if you're familiar with the local Tulsa area, but also using compounded products from a multi-state distributor up in North Salt Lake City, Utah called MedQuest. We offer pure substances, things that are not terribly expensive because we want them to be available and accessible to you. And then we use them in different forms like pills, patches, and creams, vaginal suppositories, troches, triturates, like little Tic Tacs to you. Bioidentical hormone therapy is one of the main things that KALON WEST dabbles in, and really not even dabbles, really corners the market in because we so believe in its relevance to the population. Not only from people who just have premenstrual symptom disorder to polycystic ovarian syndrome, which is now changing its name, or to people who have just low testosterone because they have increased metabolic demands or in a little bit of an aging process. We have a real big repertoire of uses for hormonal therapy that apply to both male and female. Fertility optimization for both female and male is one of our things. We are not infertility specialists, but we can help a normal, healthy, ovulating female and normally producing testosterone male to optimize their chances of becoming pregnant together. So bioidentical hormone therapy, one of the main things. The other thing that we do is in the post-pandemic world, we learned that there are a lot of repurposed drugs out there on the market that can help sleuth and solve some unique things. Like for example, Amlexinox. Probably haven't heard of it. It used to be used for aphthous ulcers in America as like a gel or a paste, then stopped. Moved over to China, is now used for asthma and allergies, kind of as a compounded capsule, but acts kind of like a steroid without the side effects of being a steroid. And now we've swung it back to the United States with a rebranded purpose for a whole host of things. We're seeing it lower A1Cs. We are seeing it help with mast cell activation syndrome primarily. Some really unique things. And so KALON WEST is aware of those types of market opportunities and advantages of repurposed pharmaceuticals and nutraceuticals. We use nutraceuticals too, don't get me wrong. But when it comes to prescriptive privileges, we're aware of things like methylene blue, which yeah, you can get over the counter if you like, and you can buy it off of Amazon, but probably better to get it from a quality source compounded and have a practitioner who knows that there are some reference range limits that will be applicable to you based on your weight, and also some side effects that you might not want, you might want to watch for, in addition to some contraindications as to why you shouldn't use it. Like for example, if you're on an SSRI or an antidepressant, or you have a planned surgery come up with anesthesia, methylene blue is not for you, not right then. You could be at risk for serotonin excess. So KALON WEST uses repurposed pharmaceuticals, but for some very unique solve it, sleuth it strategies that you might not have access to at your traditional primary care just because they're simply not aware, or they're maybe not looking for it given the bread and butter of what they're doing. But what we're doing has very Nancy Drew type solutions to things, is the way I like to put it. And so KALON WEST will offer services to you that are a little bit new around the street in sense of what they're being rebranded for, but they're old drugs that have quality and safety to them. They just have a unique difference in their efficacy because we're repurposing them for other solutions and strategies. So bioidentical hormone therapy, repurposed pharmaceuticals for some unique conditions and things. And then we do dabble also in just immune health support. It's the best way to say that. If this post-pandemic world taught us anything, it's that we need to have strategies to keep us out of trouble when viral illnesses come around the block or new contagions and things. And so we can get you medications to perhaps have in your back pocket for use, so that way you can stay healthy. Is the best way to say that. And or in this post-pandemic world where we really kind of muddy the waters with immune system issues, autoimmune diseases, some cancer states, blood clots, and other questionable things, we can look at your risk profile based off of whether you had infection or rejection during the pandemic, and we can get you better sorted on how your health is doing and look at you for any red flags that may be developing down the road, because we have to consider that in our differential of everybody who had an interaction with the pandemic experience. So those are my 3 primary categories of offerings right now. We also do use peptide therapies. I'll say that. I would add that more into the repurposed pharmaceutical space. But peptides like oxytocin, nasal spray for migraines can be a godsend, especially for females. Some things that are a little bit more new, like PT-141 for enhanced sexual desire and experience. Other things, let's think in peptide world. There's just a whole host, so come see me and we'll talk. But KALON West, why I'm holding the card is because this is the original card from which I found that name KALON, which meant inward beauty, inward beauty that is more than skin deep, but really in other translations also means health. And so thriving health, bringing you health from the inside out is the purpose of KALON West, and we dabble, and not just dabble, but we do really well and excellently in serving you practitioner patient experiences that can help with, let's say, immune system restoration and safeguarding, post-pandemic issues, regenerative medicine, and bioidentical hormone therapy.